Brilliant. Thank you everyone for joining us on your Sunday evening. My name is Philip Braham. I am the founder of Medimatch.io. We are a talent platform for healthcare professionals, matching you to the perfect positions, the perfect careers. We're now a community of many thousands of healthcare professionals, ranging from nurses, ODPs, and radiographers, both in the UK and overseas. And we're on a mission to empower healthcare professionals to do the job they love. We do that by creating free tools, whether it's webinars, social events, career tools within our platform, to be able to do the job that you love. So I'd like to introduce our guest speaker tonight, all the way from Maidenhead. Maryke is, she works at the Cromwell Hospital in London. You have recently changed positions, so you'll be able to introduce yourself better than I will. But tonight's presentation is on building a successful career in critical care ICU. So Maryke, without further ado, please introduce yourself.
Well, thank you so much, Philip, and thank you for having me. So my name is Maryke Woest, and I am originally from South Africa. Hi there, your hand is up. Do you want to say something?
I would just say make sure that people know to ask questions on the bottom right. We'll save questions to the end.
Right. So as I said, my name is Maryke Woest. I am originally from South Africa, hence the accent. And as Philip said, I work at the Cromwell Hospital, and I started there in ICU. And in November last year, I've moved into the practice development lead role at the hospital. But I'm very happy to talk to you guys about ICU and how to build a successful career at ICU, because that is mostly what I've done all my life. So the things that we are going to look at tonight, and I don't want to bore you with a PowerPoint, but it's to guide me on what to say to you guys. So the focus points for tonight, we're going to look at the journey, otherwise known as the story of my life. Essential skills when you work in ICU, educational progression for ICU, other career progressions, or what you can achieve while working in ICU or from ICU, and then some helpful hints. So the story of my life in ICU started when I was a student. So I studied in South Africa, and back there we do a 4-year course. So when I was my first year, second placement, and our placements are also different from what you find in the UK, where students have 3 placements a year. We have about 6 to 7 placements a year. We study and work continuously at the same time. So you study and you work twice a week, and you work nights and days, and you work over Christmas, and you work over the summer holidays and the winter holidays. And so you are part of the workforce for most of the time. And the only time that you won't be there is when you write exams or when you go to class. So in my first year, second placement, my father became really ill. And on the day that I did my first resuscitation in a surgical ward, he was admitted in another town, Pretoria, which is close to Johannesburg. Most people know Johannesburg, so I can say that. When he had a brain aneurysm that burst, and he was in ICU for 2 months, and he was in rehabilitation for 3 months. And it's actually a miracle that he survived, because patients who has a brain aneurysm that burst, most of them pass away. So that was the first time that I saw ICU, and I thought, wow, this is amazing. And then I was a military student. And in my second year, I was supposed to do nights, and I was told I'm going to the neurosurgical ICU. And the second year, you don't know much. You can give medication, you can do wound care, you can do observations, you can do all those bits and bobs, but you can't look after an ICU patient, really, to be very honest. And I walked into the ICU and the sister said to me, so how much experience do you have in ICU? And I said, I have no experience. I'm a second year student. And they rolled their eyes and they gave me my own patient. And that was, for most of you guys, that's a big no-no. But I am the person who needs that kind of support or that kind of nudge. So my patient was a patient who had a craniotomy. He was ventilated, he was sedated, he had lines out of every orifice almost. So it was a bit scary, actually very scary. I had no idea what a ventilator was. I just know it was giving the patient oxygen and helping the patient breathe. And I just watched what the other nurses were doing, and I was doing the same thing. They do bloods. Then I said, how do I do bloods? They would show me. In the morning, the sister said to me, my surname then was Skuman. And she said, Skuman, you did really well. Come back tonight. So at the end of the day, I worked 7 nights in neurosurgical ICU, and I loved every minute. Of course, I had no idea what I was doing, but the patients survived and the sisters were happy and the patients were happy. So it was a really good experience. So when I finished my 4-year degree, I went to Pretoria, to the military hospital there. I worked for a year in orthopedics, and then I moved to ICU. And I thought I knew everything, of course, but I had no idea. And hopefully today or tonight, while I'm telling you about how to build a successful career, it might help you so that you don't fall in the same pitfalls that I have. So I did my 2 years in ICU, my 2 years post-degree working in the military. And then I came to the UK for my first experience, and I joined the NHS, and I was a scrub nurse in orthopedics, and I really enjoyed it. But my first love was always ICU. So back home, went to ICU, worked for about 6 months, and then I went to a prison. Not being a prisoner, being a nurse, working in a prison, didn't like it at all. It's not for me. And then I only did it for 3 months. The biggest problem there was they wanted me to work outside my scope of practice. I had to provide medication to the clinics as part of the prison. And for me, it's very important to work in your scope of practice. So I went back to ICU, did my ICU postgrad certificate or diploma back there in the UK. It's 6 months. In South Africa, it's a year. And it's almost something like an advanced critical care practitioner, but I'll tell you guys a bit about later. Then after I did my qualification, then my life became very exciting. I became part of a British company. It was first called Frontier Medical. Then it became Frontier Medics, and it's now called United Healthcare Global. With them, I went to Bosnia, where I worked with the United Nations in a small ICU. And after that, I went to Iraq for 6 months, working with the British Armed Forces, which was an amazing experience. Having a bit of a military background, it was great to see how other military entities operate. And I functioned as a shift leader while I was there. I did fun stuff. Didn't see a lot of patients, which was fantastic because you don't want to see sick patients or injured patients while you are there. I drove a tank, the Challenger 2 tank, just for the fun of it. I learned how to drive a fire truck while I was there, so it was lots of stuff, lots of fun stuff. And then I went into the oil and gas industry, where I was working on board a ship, not a cruise ship, a small ship that is searching for oil and gas in the seabed. And I was the medic on board, where I worked totally independent, prescribing medication, assessing patients, giving first aid training, giving health advice. So it was quite a good experience as well. But again, ICU is my first love. So I went back to ICU, became an ICU specialist nurse in South Africa, and then I moved to the UK. And I've been with the Cromwell Hospital now for 6.5 years. I started as senior staff nurse, and then in 2018, I became the educator in ICU, but I still did some clinical shifts as well. And then November last year, I became the practice development lead. So that is my whole story. The good and the bad of it, it was a good story so far. Would I have changed anything of it? No. I loved every minute of it, just the way it was. Okay, so let's look at the essential skills that any ICU nurse could do with. And some of it, you might know all of it, but this is just to give you some pointers in case you are very new and you're still very concerned about where to start and you need a bit of guidance. So let's look at technical skills. Now, both clinical technical skills as well as your soft skill is very important when you work in ICU. Now, technical skills is to do with how you do observation, what your clinical knowledge is. So those can help, and those things are going to help you to support and monitor and assess your patients adequately. Then the second one is passion for the job. Now, personally, I feel you should not do a job that you do not like. So you should love the job that you do. I don't think I would have worked 20 plus years in an ICU type of environment if I did not love my job. I'm very passionate about nursing. I'm very passionate about teaching, but I'm very passionate about ICU. So if you can go to work with enthusiasm and excitement, then you know you love what you do. And there's a difference between doing a job and doing a job well. And you should be just as excited about a Monday than you would be about a Friday. People that work from Monday to Friday, they're very excited about a Friday because they know it's going to be the weekend. But if you can get up on a Monday morning and you're just as excited as what you would be on a Friday morning, getting up knowing it's going to be the weekend, then you know you're in the right place. Being a team player. Now, one of the things is I've done plenty of ICU interviews for new recruits, and sometimes I'm still involved, not so much anymore, but not so long ago I was still involved. And one of the things people ask, what we ask people many times is, what is your strengths and what is your limitations? And many times people will say, I'm a team player. But sometimes I wonder, do people really know what is a team player? Now, team play is a very valued skill. And what it means is to be ready, to be willing, and to be able to support your team, even if you do not know what's going to lie ahead. I mean, you don't know when COVID's going to hit again. So are you ready, willing, and able to support your team no matter what? It is to be unselfish, and it is to put the success of your team above your own. The next thing that I have on my list of essential skills are organizational skills and or time management. Now, as you heard, I've been in the military before. For me, punctuality is very important. It shows a lot about your character. It also shows the respect you have for your fellow colleagues. So time management is being on time at work, but also the strategic planning of your day when you have your patient. You need to know what your patient's going to require for that day. And that happens from handover. So if you're on time, you'll have a proper handover, and then you know what you'll need for the day, and then you can plan your day accordingly. A little to-do list is a good way to start and organize your day. Later on, when you're a well-versed person working in ICU, you don't need a to-do list because you know exactly what you're going to do when you're going to do it. But when you start to do a to-do list or a checklist is quite a good thing to have at hand. The next thing on my list is communication. Communication is so important. We all communicate in different ways. I like using my hands when I communicate. I'm a touchy-feely person, so I'll put my hand on someone's shoulder when I talk to them. But we're all very different. And some of us are quiet, some of us are abrupt. But we need to realize that when a person is very quiet or abrupt, it is not a personal thing. It's just the way that they do their job. Part of communication, it includes feedback, being an active listener, and it contains both verbal and non-verbal communication. We know that non-verbal communication is just as important as verbal communication, and many times that's the thing that people will see before you even say a word. When you come with communication, you have to have, it shows that you have confidence in what you are doing. And we must also remember part of communication is to have confidentiality at all times. So when I said feedback, when you are working in ICU, actually in any place, it's good to get some feedback on where you are and what you are busy doing and how you are doing your job. And but then we should be open for when we receive that feedback, because sometimes we would think we are doing an amazing job while our senior don't think the same thing. So then we should be open and then reflect on what is being shared with us when we receive that feedback. Emotional intelligence, and that's part of your soft skills. So technical skills and your soft skills. So emotional intelligence is part of your soft skills. So that is your self-reflection, your what you know about yourself, your strengths, your limitations, how you are dealing with your emotions, how you manage stress in your life. That's all part of emotional intelligence. It's also to notice when other people are struggling without them actually telling you they are struggling. So it's just as important, the same as social intelligence is just as important as your actual IQ. And then self-care. That is when you know when to take a break, when you have reached your limitation, when you need to have that annual leave, when you need to step back and not do that extra shift. So self-care is also very, very important. Now, when we look at the educational progress in ICU, we all start fresh. Some of us have been working ICU for many years, and some people are very new in ICU. No matter if you're new or well-versed in ICU, you will start with a period of probation. Now, I don't know about the NHS, but in the Cromwell Hospital, probation is 6 months. Part of that, during your probation, you'll have a period of supernumerary, where we will introduce you to the ICU environment, make sure that you are safe, that you feel safe, that you feel included. And that is a time when you will work with people. During your supernumerary period, you will never work by yourself. You will always be with someone. Our supernumerary period in ICU, for someone who has a bit of experience in ICU, who have been there for a while, would be 4 weeks. If it's someone brand new who's never been in ICU, we will reflect and keep an eye and have frequent conversations, and then we can decide, do we need to extend that supernumerary period or not. After probation has been completed, then you'll be allowed, sounds awful, then we will be able to support you with funding when you want to progress in your career. So if you have not have the ICU course, then we will start with the Intro to ICU course. We are currently doing it through the Royal Free Hospital, who is affiliated with the Greenwich University. It's a really good program. And during that time, the nurses also complete the Critical Care Network Step 1 competency booklet. Then after that, after you've had some time to adapt the new skills you've acquired. Then we'll move on and get you to do the critical care course. And during that time, which is also about a 6-month course, at the moment we are using the University of West London as our higher education provider. And during that period, you will be able to complete your critical care steps 2 and 3 competency booklets. Thereafter, you'll be able to transition to a senior staff nurse, and then if all goes well and we have the positions available, you'll even have the opportunity to become a charge nurse. I know we are very different from the NHS. Not every person that works in ICU do progress to a senior staff nurse role or a charge nurse role. People have to actually apply for those roles. So not everyone will just progress from a band 5 to a band 6 to a band 7. But we have positions in all of those areas available at the moment for band 5 and band 6, and I think there's one band 7 position available at the moment. Okay, so that's our educational progression. When we look at other career opportunities, once you have your ICU course completed successfully, you can become a critical care outreach team member. They are people that have the ICU that has completed the ICU course, and they are a vital role in the hospital. They are the link between ICU and the wards. They're part of the resus team. They go see patients that score a new score of 5 and above, or where the new score is 3 in any of the single observations. They also, when you become a critical care outreach team member, we do have a critical care outreach pathway to help support you during the induction period and supernumerary period as part of the critical care outreach team. And then we also send them to the University of West London to complete a advanced assessment and history taking module, which is quite good. Otherwise, you can go into education. There's not a lot of education positions available at the moment, but that is an option. So as I was the first educator in the hospital, and we now have 8 educators in the hospital. So we have 1 in every department. Then also clinical nurse specialists. We have plenty of clinical nurse specialists in our hospital. I've made a list, so let me just get my notes here. So we have a diabetes clinical nurse specialist, also for allergies, urology, infection, pain, breast, oncology, head and neck, stoma, transplant, cardiac, transplant assessment, and tissue viability. I hope I haven't excluded anyone. Now, one of the nurses that who started in ICU with us, she won't mind me mentioning her. She started as a senior staff nurse in ICU, very passionate about her job, well loved by the team. And now she has transitioned into the head and neck specialist nurse role. So there is a vast amount of opportunities available in the hospital, and not only in our hospital, any hospital where you go. ICU nurses are well loved and well liked and very popular because of the extent of exposure that they get when they are working in ICU. Another role is the advanced critical care practitioner. Unfortunately, we are not able to offer that role at the moment at the Cromwell Hospital, but it is something that is gaining momentum in the UK. It's a 2-year course. I know there's quite a number of trusts that are advancing into that area. I know the Royal Berkshire Hospital has advanced critical care practitioners, and then a few of the bigger trusts in London. It is where you are part of the medical team, where you can see patients, we can evaluate x-rays, we can help with the insertion of lines and do prescribing as well. So it is a very good course. I would love to do that, but now I'm doing the practice development part. And then of course, management. One of our nurses, and she won't mind me calling out her as well. She started as a bank nurse in our department, actually in the surgical floor, and then she became a bank nurse in ICU. And then she was a band 5 for some point in time. She resigned, she came back, and then she became a senior staff nurse, then a charge nurse, and then now she's the deputy matron. So there is lots of opportunities to advance when you're working in ICU. My last slide. I hope I didn't go too fast through everything. So some helpful hints from me personally. So first thing, build your CV. So what do I mean by that? CVs, when you want to apply for a job in ICU, it's good that your CV is very clear, very professional looking, and it should be true. Okay, so I'm saying this because I've seen it before. When you say you can do something, make sure that you can actually do it. It should be, the spelling should be correct, the layout should be good. So get someone to help you with it. I'm sure there's some recruitment agencies that's more than happy to help you with the layout of your CV, but it's important to get those chronological order ready of your CV. I'm more than happy to help anyone build their CV, but make sure that what you put in it is what you actually achieved, and brag about yourself. Brag about yourself in those CVs. Make sure that we know exactly what have you achieved so far and what is the dream. When we do the interviews, even if you do not have a lot of experience, because we are a private hospital, we have ventured and had newly qualified nurses last year. It was an experience. It was a good experience. It was a successful experience. But at the moment, if you have a year or so experience, that's good enough to start your career in ICU. We will learn a lot about you when we have your interview. And of course, we look at your CV, we might ask you something about it. Second one, get that notebook. This is my notebook. This is what I started with in ICU. This is my second one. The first one was 4. So have that notebook with you when you come to work. Have it ready with your orientation, because it's important to write down those little things that they tell you, the number, the lab, say for instance, little things. They might just mention something that's not in your induction book, and then you can just jot that down in your little book, and then it can build up. You can see mine is busy falling apart, but it's a very good thing to have. Ask the questions while you are doing your orientation as well. And so that's part of the equipment that you have to ready when you go and work in ICU. Then develop a routine. Some people are really good at it, some people struggle. So for me, when I started in ICU, I had a page and I made a little list of to-dos and checklists. And then, yes, this time I need to do this. So my days will start with my safety check. Then I have to do my assessment. Then at some point in time, someone's going to relieve me for a break. I need to know exactly when I'm going to give my medication, if there's anything that the doctor wants me to do. So get in a routine. And then later, you don't even need to have those little prompts to help you with your routine. It will just fall in place. And then next one, have realistic expectations. So know your limitations, know where you are at, have grace with yourself. When you start in ICU, you're not going to know everything. Don't be like Maryke. When I thought I'm going to know everything when I went to ICU. Don't be a Maryke. Be who you are, but be a bit humble, okay? And if you're a smarty pants, good. I like a smarty pants, but just be mindful, have grace with yourself, and know your limitations. No one knows everything. Okay. And we all, an ICU is a very stressful environment. So make sure that you have grace with yourself. Next one, learn while you're at home. If you looked after a patient with pancreatitis today, go home, make some notes, go and read up on it. Then things will fall in place. Ah, yes, he was complaining of this kind of pain. Okay, so that's what it means. So then you can get to know the different conditions while you are at home. Don't have to make a big thing. I live outside of London, so many times when I started in ICU here in the UK, if I looked after a patient on my way home on the train, I would go and Google and I would read up about the patient. Or if I don't understand something about, one or the other blood tests, I would read up on it in the train and make a few notes. So next time I'll know better. All right. Lean through the hard and the scary. Okay, this can be anything that's intimidating you. Speaking to the doctor, you know, that one consultant that's really scary. He's got the eyebrows. Okay, so this is where you're going to have to learn to lean through the hard and the scary. You have to talk to that doctor at some point in time. Might just get it over and done with. I mean, I can remember my scary moment when I was working in the NHS in theatres, and there was a very stern Scottish orthopedic surgeon, and you do not ask him any questions. So my first day as a scrub nurse, the sister asked me, so do you want to scrub for the doctor or do you want to assist him? I said, well, I have no idea what to do with a shoulder replacement, so I think I should assist him so I can actually see the operation. And it's a very cool operation, by the way. So they take the ligaments and they tie it away with some forceps. And then I said to him, why are you doing this? And then you could hear people taking their breath in and holding it because I dared to ask this scary surgeon a question. And he stopped, he looked at me, and then he explained the whole procedure to me. So I leaned through my hard and the scary at that point in time, and it paid off dividends. Started working with that surgeon quite often. It can also be things like you don't know much about ventilation. You're scared with the renal replacement machine, the type of patient that you're going to look after. Ask the questions, ask for help. Read up on it, say for them to the people, I want to look after this patient, I want to do renal replacement, but I've never done it. I feel a little bit worried, a little bit scared. The educator can work with you. You can buddy with someone. So just make sure that you go for it. Don't be scared. Don't be scared. We all have to start somewhere. So don't be scared. And the last one is fail to prepare leads to prepare to fail. This is about your time management, having that checklist. If you do not prepare, anything can go wrong. Some of you might know this, some of you might not know it yet, but ICU, things can change quite rapidly. So it might be all smooth and serene and calm in the unit in the morning, and then all of a sudden things change dramatically. So to help you not fail, keep to the time, make sure you've got everything ready and do it on that time. If it's a calm patient, anything can happen to that patient as well. If it's a very stable patient, that patient can become unstable. They are in ICU for a reason. So make sure that you do things when you were supposed to do it. So when things go wrong or you are allocated an extra patient because someone didn't turn up, you'll be able to manage that successfully. And also part of that fail to prepare leads to preparing to fail is stress management. Be kind to yourself. Remember, we're not here to only work, we are here to live. Okay, so make sure that you make time for yourself outside of work. Make sure that you have a hobby that you can do to de-stress. Make sure you have that person that you can talk to. Okay, get involved with the social activities as well, if the hospital or your department is having those activities as well. So be kind to yourself. ICU is a fantastic environment to work in. I honestly, I mean, I've been in theaters, I've been in the wards, I've been in a prison, I've been on a ship. ICU is a fantastic environment to work in. And when I came to the Cromwell the first day, I thought, don't think I'm going to make it. I'll have to find another job. 6.5 years later, I'm still there. So when you make that decision that this is not for you, make sure that you make the decision when you're not in a place of stress. Okay. Make sure that you make the decision when you are calm, when you are in a good place. Because when you're in a bad place and you make the decision, then you can make the wrong decision. Okay. And remember, you need to give, when you are moving into a new environment, give yourself 3 months to adapt to that environment. Don't quit after the first week. Okay. First week is going to be hard. Second week as well. First month is going to be hard, and then you're going to start to settle in. But give yourself always 3 months before you move if you feel you are not happy or you can't adapt. I always tell people that, and I had to do the same thing when I moved to the UK. Okay, thank you so much. I think that's what I have to say.
Brilliant. Virtual round of applause, everyone. That was fantastic. One question that I had just quickly was on kind of the drug calculations that you ask at interview. I think that when people hear that they got to do drug calculations, they get a little bit frightened. How comes you ask them to do that interview? What are you expecting, and how can they prepare?
Okay, so yes, I know drug calculations, everyone's worst nightmare. It's not difficult. Okay, that's the first thing. We want to know that you have a basic knowledge of drug calculations. It means you need to know from milligrams to grams, micrograms to grams, those kind of things. There is one question about percentage, which normally throws people, but to prepare people adequately, we do provide the recruitment agencies and recruiters with drug calculation booklets to support them to prepare for those questions. It's just 10 questions. It doesn't take longer than 15 minutes to complete. It means how much furosemide are you going to give a patient? Heparin treatment and those kind of things. And blood transfusions, and it's not a difficult blood transfusion thing. It's just plain straightforward. So it's to know that people can give medication accurately. I mean, if you have been a nurse for a while, we expect people to actually know how to give medication, and we need to know where you are at for us to when it comes to drug calculations. That okay, Phil?
Great answer. There's a few more questions, so you can't leave us just yet.
I don't want
if people have questions, please put them in the chat box at the bottom right of Zoom. If you have a question, please type it out, and I will start asking them now. For a nurse considering ICU, would you recommend a variety of specialty experience before pursuing ICU, like you did, to get a broad knowledge, or solely focus on ICU entirely?
It really depends on yourself. As you've heard, I was a social butterfly. I mean, I jumped from this to that. It's not everyone's forte. So if you just pursue ICU, it's efficient. You jump on a ship, go drive a tank in Iraq. You don't have to do those kind of things. For me, that was exciting, and that was things that I like to do and pursue. And it's a good conversation when you can share things like that. But you don't have to do that. You can just be in ICU.
Brilliant. Another question, what courses would you recommend for a new nurse and also an experienced nurse?
Okay, new nurse, you will start with Intro to ICU course, which tells you a lot about the A2E assessment. In-house, I developed a course that is quite popular among the nurses, and it is the recognition and management of the acutely unwell adult patient, which also focuses on A2E assessments. It's a 2-day course, so it would also be good for a new nurse to do that. And then of course do your mandatory training, do your ILS, do your medical gas, and then we'll send you on transfer course of ICU patients and a ventilation workshop and things like that. And so you'll start with your introduction to critical care course, and we will send you on it as soon as possible after probation. We try to send people as quickly as possible to courses because we know your development is very, very important, and we try to not to delay it as much as far as possible. Unfortunately, we can't send everyone at the same time. We can send a maximum of 3 or 4 people on a course. And then after that, you'll do your ICU course, and then there will be some pathways that's in-house, like a shift management pathway, where we can guide you to become a bit more experienced in becoming a shift leader. And you don't have to be a band 6 or a senior staff nurse to do that. You can even do that when you're a more senior band 5, so that we can prepare you for when you will be ready to become a shift leader or a band 6 or a senior staff nurse. For someone who's got some experience or experience in ICU, it depends on what you've completed already. If you have been working in ICU for 3 or 4 years and you are quite confident and competent in ICU, there's no need to do the intro to ICU course, especially if that experience is based in the UK. If it's from outside the UK, it depends on where you worked and what kind of ICU you worked in. Was it HDU or was it a level 3 type of patient ICU that you've worked in? And what kind of patients did you see when you were working in that ICU? If you have a lot of confidence and competence, then, and you have not done your ICU course yet, then we will send you to the ICU course.
And on that, the next question leads nicely onto that. What is the critical care course like? Is it a number of modules? Is it both theory and practical?
Well, I haven't done my course here. Mine was very practical. I mean, I have to say, I wish the course that was given to the people in the UK was a little bit more like what I've experienced, because you had to be able to read X-rays, you had to be able to intubate a patient, you had to do all those kind of things, which is not expected from someone in ICU in the UK. So don't worry, you don't have to do those kind of things. It's not expected of you. So the universities, there's quite a number of universities that has the ICU course, and it's normally 2 modules. It's normally 60 credits. It's delivered at level 6 and level 7. So level 6 is for people that comes from abroad who has not done a level 6 course, nursing degree or something in the UK. So then they, or you haven't studied in English before. So they would say, do a level 6, because a level 6 is an OSCE and a Viva, and you deliver a poster, where level 7 is you write an essay. But with both, you do a bit of an exam, where you get a patient study, where they ask you loads of questions about the patient. How are you going to manage the cardiac side of, say for instance, a patient is patient with respiratory distress and they are ventilated, and this is what the blood gas look like, and the patient's on noradrenaline and those kind of things. And then they're going to ask you about, what do you think about the ventilation? Is it appropriate? Is it not appropriate? And then how are you going to change it? Or what is the pathophysiology behind why you need to give, why the patient has respiratory distress? So those kind of things. And it's really an open book exam, because you can write down, you don't have time to go and read it, you have to be prepared, but then you can go and use your references when you write your exam. And it is a bit practical. They do go to class now. When it was COVID, everything was online, which was not ideal, because you need to be able actually to get your hands on experience when you are going to treat a critically ill patient, and if you want to learn about how to become an ICU nurse. So it is practical sessions as well.
Okay, great. If you've been in ICU for a while and want to transfer to other specialties, where are their synergies? So the other specialties that you know, someone's spent a few years in ICU,
Yeah.
and actually, do you know what? You could try something else now. What would it be?
Good question. I would definitely try to become a specialist nurse. Like I told you guys about this, my colleague that's now the head and neck specialist nurse, because there's a lot of tracheostomy training. So something like that. Tissue viability, infection control, because it's things, ICU, so you deal with so many things, you know, you focus on everything for your patient. So you focus on infection control, tissue viability, pain management, tracheostomy care, stoma care, everything. So your patient, you nurse your patient in totality. So I would say a specialist nurse would be a good option. Outreach is another good option. Even anesthetic nurse, because, or a recovery nurse, recovery specialist nurse, because you deal with A2 assessments all the time. Another, it would be the advanced critical care practitioner, but that is not for everyone. Educators, a good role for any ICU nurse. Yes, even home care, if that's what you are in for. Or independent practitioner, but then you have to do a prescriber course and things like that.
Great. Do you employ nurses at Bupa without ICU experience but willing to learn? That's a good question.
It's a very good question, and it really depends on what kind of experience you have. In the past we have. At the moment, it's difficult, if I have to be honest. At the moment, it's difficult because our team is very young. But never despair. Apply. I mean, we can look at your CV, and if it's a good CV, definitely would consider it. But at the moment, the here and the now, we have a very young new team. So we want to make sure, if we say yes to such a person, we want to make sure that we can support the person adequately. That's all about, because we need to make sure that you are safe. Because if you are safe, you'll be able to adapt better, and you'll be happier, and you would want to learn, and you will succeed. And we want people to succeed. It's, for us, it's all about development of people.
Yeah, absolutely. Another question, last couple. Hi, Maryke, thank you for the talk. I'm a newly qualified nurse, and ICU was the placement I enjoyed most, so naturally I want to work there. What advice can you give me of places, areas to work in before I go straight to ICU, as most places don't take newly qualified?
Yeah. Becoming a nurse in ICU, that's what I said to one of our newly qualified nurses. I said to her, the dream of ICU and the reality of ICU is sometimes two totally different things. Okay, well, it is not sometimes, it's all the time totally different things. As a student nurse, it can be a dream, right? So thankfully, I was not, my experience as an ICU was a bit different as a student, because they just gave me a patient, and I just had to cope, right? But I know the placements of students in the UK is different. So where should you work? And I know There are some trusts that take newly qualified nurses in ICUs. There are some trusts, but I would say start in the NHS. After our experience with the 2 newly qualified nurses that we've had, I would say start in the NHS. If you have to choose which department to work in, to gain some experience before you transition to ICU, any environment, but an acute environment like a medical ward or a surgical ward or an orthopedic ward, something where you will see lots of different types of patients, and that will guide you and support you with your development so that you then can transition to ICU. That would be my suggestion. When I was a newly qualified nurse, I wanted to go straight in ICU, and they told me no. And they put me in orthopedic ward. And looking back, I think that was the best thing for me to do, because it gave you some time to get perspective who you are as a nurse and give you time to become familiar about what is expected of you at being a registered nurse, and then transitioning to ICU. I hope I answered the question.
Great. One question I had before we wrap things up. There's been quite a few people that have joined from overseas. You came from overseas to the UK. What advice would you give to kind of international nurses that haven't started their journey in the UK or just about to start their journey? Obviously, it's very daunting to start in a completely new system. Could be quite scary. So what advice would you give to new nurses starting out in the UK?
Okay, where to start? Okay, so do a lot of research. See what come to Philip and his crew, or any other recruiter that you want to make use of, but Philip and his crew is quite good. They will support you as well. Make sure that if you are invited for an interview, that you get to know about the trust before you go for your interview. Google some photos, see what it's like, read the CQC report, see what people say about the environment, see if people are happy to work there. Because at the end of the day, you will need extra support when you arrive here. London is not for everyone. I'm very glad that I don't live in London. I always said I won't live in London and I won't work in London. Last famous words. So it's expensive to come to the UK. The visas are expensive. Your NHS registration or your NMC registration is expensive. Okay, so Philip, are these people who already have their NMC pins?
It could be people that are just starting out the NMC registration, or it could be people that are about to land in the UK. So,
right. So, to get your NMC registration does take some time, because you need to get a transcript of training from your own university where you studied. You need to do your CBT, which is a multiple questionnaire. You need to do OSCE, which you have to come to the UK for. And you have 3 opportunities to do this OSCE. You need to provide evidence you can speak English, and then you have to obtain your visa. Now, if you have already obtained your, and you can't really get a job if you don't have your NMC pin. But to get that visa is quite expensive. So make sure that you start already in your home country with the whole process. I had support from a recruitment agency when I came here, because I was a visa holder until last year. So it does take some time. Prepare yourself. If you're still in your home country and you're still busy with all the visa preparation before you come, it can take up to 6 to 8 months, depending on how fast or slow the visa process is. At the moment, it's a bit delayed because of everything that's going on in Ukraine. So obtaining visas does take a bit longer. But start to search for a job. Look for what you want to achieve. Write down the pros and the cons of coming to the UK. Why do you want to come to the UK? Make sure that you are sure of why you want to come to the UK and what you want to achieve while you are here. Because once you're here, you go through up and downs. It's not always as easy when you start a new role. Some people are more adaptable than others. So make sure that you are ready for what lies ahead. Ask questions. Speak to people that went through this process. Is it just you, or is it your family and you? Because that also has a big influence. For me, it was me and my husband and son, but I came before they did. So I was the person who had to search for a house, got a car, got the job, and then have to prepare everything, got a school for our child, and have everything in place before they arrived. And the adjustment was still big. You're going to miss your family. You're going to feel very lonesome. So make sure that if you are someone who goes to church, investigate the type of churches that you want to, around the area that you want to go to. Look at the area that you want to go into. Look at the hospitals that's recruiting you or that you've said yes to. Look what houses cost or rent accommodation cost around where you want to go to. So all those little things that will be able to support you. Check what kind of shops is there. Make sure that you will feel comfortable. But know that this transition will be very big. But it's a good transition. I mean, 6.5 years later, I'm glad we made the transition. 3 years, when you have to apply for your second visa, you go through, do I really want to do this? And then once you're through that, then you're okay. And then after 5 years, you can apply for your indefinite leave to remain. Then you go through that process again. Is this really what I want to do? Because you're getting closer and closer to obtaining that that passport if you're someone who is going to venture into becoming a British citizen. If you're from Europe, you don't need all of those things. Then you can just apply for your NMC PIN. I think it's easier for people from Europe. Not jealous at all, but just make sure that it's going to be a big transition no matter where you're from. Okay, language. They speak English. We all speak English, but we all say things differently, and what we say is not always what we mean. So it's just getting used to a different way of life. Nursing is nursing, but it is a bit different in the UK than from where you might be from.
Okay. Great, brilliant. We are out of time. We had just a last comment. I've had some amazing managers who've been ITU trained, as the critical thinking skill set is so important to be a great leader. That's a nice way to finish.
Yeah.
Brilliant. So thank you so much for your time. Thank you for taking out time on Sunday evening and preparing for this in the week. I've thoroughly enjoyed it, and I'm sure everyone else has. If you are overseas or in the UK and you're looking to build your career, feel free to sign up to Medimatch, www.medimatch.io, and build your profile on there, and we'll help you with your CV, and it'll be all formatted in the correct way. And we have nurses that work for Medimatch that can help you if you have any questions about your career within the UK, or if you're not sure about certain things or the journey you want to go on. So feel free to register, sign up. It's totally free for healthcare professionals, and it will always remain free. So thank you so much. We'll let everyone go. It has been recorded, so it will be on our YouTube channel in the coming week. So thank you so much. I'll clap. I'm sure everyone else will. Brilliant. Take care, everyone. Thank you so much. Goodbye.
Bye.
Thank you. Bye.